Welcome back to more of We the People. You know, the American Red Cross needs your help. The organization has a critical shortage of type O blood and urgently needs blood donors of all blood types. Joining us now from the American Red Cross Northeast Ohio region are Christy Peters and Jim Mcintyre. Two good people working with a great organization, the Red Cross. Christy is External Communications Manager and Jim Mcintyre is Communications Manager. Good to have you with us.
Thank you for having us.
Tell me about the overall mission of the Red Cross in collecting blood. That is still vital, isn't it?
Absolutely. The goal of the American Red Cross is to provide the safest blood supply for the American people and to ensure that patients across the country always have the blood that they need on the shelves. And so we're always out there talking to the community and talking to donors, reminding them of the constant need for blood and also the fact that we only get blood from other volunteer donors. We cannot manufacture it, we can't make it, we can only get it when good people volunteer and roll up their sleeve to give.
Jim Mcintyre, you would say this is the gift of life, isn't it?
It is the gift of life, Leon. Every donation you make has the potential to help save up to 3 lives because that blood can be divided up into different products. So we ask people to think about every 56 days when they're eligible to donate, to make an appointment at redcrossblood.org and to go to their nearest blood drive and to potentially help save 3 lives.
Now, I said at the introduction, there is a need right now for type O blood, but all blood types are needed, right? But especially type O right now. Talk about that a little bit.
Well, type O negative is the universal donor type. You can, the blood that's on the shelves right now, if an emergency trauma patient comes in and there's no time to find out what their blood type is, they reach for that.
They reach for O negative.
Yeah, so that's the most valuable, I guess, type of blood that you could donate, but we need all blood types because the need is constant. And as Christy mentioned, we can't make it, we can only get it from donors, generous people who give of their time and roll up their sleeves.
I have given blood. I am type B, by the way. You can always use type B.
Positive or negative?
I think it's positive. I believe it is.
I wouldn't be surprised.
The U.S. Army told me that when they took the blood test years ago. This is important. How do people register to do this, or do they have to register?
We always encourage people to make appointments. That helps them in planning their day. We know everyone is busy and we want to make sure that we use your time efficiently. So by scheduling an appointment, we know you're coming and that helps us prepare, and then also you have your appointment and you're ready to go. So again, we know people are busy and that allows us to prepare and gives you a time. And you can actually do that on your smartphone now. The American Red Cross has a blood donor app, and the app is free. It allows you to schedule an appointment. It allows you to find blood drives near you. When you actually go and donate and you do your health history, which is where we're checking your hemoglobin levels, your temperature, all of that is recorded in your app, and so you'll have that to refer back to. The thing I love about it is that it reminds me when I'm eligible to give. As Jim mentioned, you can do it every 56 days, but since I usually can't remember what I did yesterday, much less 56 days ago, the app is a great thing to have to remind me to do that.
When tragedy strikes, that's when we talk a lot about it, when these tragedies, these natural catastrophes take place and people get hurt, deeply wounded. You need blood then. But you also need it for the everyday surgeries that people may be going through at area hospitals, correct?
Yes, we're so fortunate where we are to have such wonderful medical facilities, and that means that there's a constant need for blood. So you're talking about people who might be having some type of transplant surgery, who might be involved in an emergency. Cancer patients who are using chemotherapy and who are fighting all types of cancers will use many blood products throughout their treatments. And so really it's an everyday need. It's not just when, I mean, obviously we want to be prepared for a tragedy, but it's people in hospitals right now that are depending on that blood.
Jim, give me a thumbnail sketch on how we do this now. You want to donate blood, maybe you've never done it before. What's the procedure? What happens?
The first thing you should do is either call 800 Red Cross or go to redcrossblood.org to make an appointment. Then you report to the appointment. We have a tool called Rapid Pass that allows you to fill out the questionnaire at home on the day of your donation so that you're not spending as much time as you would in the past before we developed that tool. And it takes all of 30 to 60 minutes, and in that time, you could be, as I mentioned before, helping to save 3 lives. And we've got a huge blood drive. You can look at redcrossblood.org for the blood drive nearest you on the day that's most convenient. But this Lander Haven blood drive coming up on Tuesday, February 11th, next Tuesday.
Executive Caterers at Lander Haven in Mayfield Heights.
22nd annual Lander Haven blood drive. We're hoping to have as many people as possible come to donate. There's going to be food. Harlan Diamond does it up right.
Yeah.
And we're going to have entertainment, and it's going to be a good time for people to come out and donate blood.
I'm going to put that on the screen in just a moment. I'm going to steal 10 seconds. I need 10 seconds. You're still doing the smoke alarm thing too, right? The smoke alarm drive, the importance of smoke alarms.
Absolutely. So we still have our Save a Life program where people can call and get a free smoke alarm. We will come install those. We work with the Cleveland Fire Department to do that, as well as other local fire departments. And we're also going to be doing some initiatives coming in the few months where we're going to ask volunteers to come out and help us save lives with those smoke alarms. So
many thanks, Christy Peters and Jim Mcintyre, both with the American Red Cross Northeast Ohio region. Appreciate you being on the broadcast. There's the information I promised to give you. Give from the Heart Blood Drive is on Tuesday, February 11th, 7 o'clock in the morning until 7 o'clock in the evening, half the day, at Executive Caterers at Lander Haven, that is in Mayfield Heights. To schedule your appointment and for more information, simply call 1-800-RED-CROSS or visit redcrossblood.org. And for volunteer opportunities, visit redcross.org/volunteers. Many thanks for being on the broadcast.
thank you.
The gift of life.